While there remains no shortage of Omicron in Oklahoma, there is a shortage of qualified healthcare workers to help combat it. And there are a variety of reasons why some of our very best frontline workers are walking away. Jason Doyle joins us now with his report. Jason.
Yes, Rich. Oklahoma City's Metro hospitals announced Monday their ICUs and ERs were full of COVID patients. At the same time, they're searching for qualified help to handle the surge.
Hospitals are warning the demand on services has become extreme during this latest COVID surge.
We are trying to adapt as best we can. And here's the hard truth. Despite our best efforts, we may not be able to provide care as we normally would.
There is a shortage of available healthcare workers for many reasons.
Between our 4 health systems, there are hundreds, and we estimate over 1,000 co-workers in quarantine or unable to come to work due to kids out of school and no available childcare.
Our nurses are tired, they're discouraged, they're overworked, they're underpaid. There's been a whole conglomerate of things that have contributed to the shape we're in now.
Attrition within Oklahoma's healthcare workforce accelerated as Oklahoma entered its second year of the pandemic.
We know we have even less staff than we had last summer when our peak hit at 1,500. Important to note, we are right there with hospitalized patients right now.
Because our workforce is also aging, retirements have increased during the pandemic.
We're seeing some of that retirement. We predicted this retirement back in 2018. And but the times weren't like they were now. And pay was actually fairly decent. So folks stuck around a little longer than they had originally planned.
According to the Bureau of Labor Statistics, more than 52,000 healthcare and social assistance workers quit their jobs in November 2021 alone. To help address the shortage long-term, programs have been established over the past few years to expand nursing and other healthcare education opportunities, but that has hit a limit too.
We did see efforts on behalf of different state agencies and the education system to beef up our nursing education programs here in Oklahoma. We're challenged because we don't have enough nursing faculty.
Our state is now competing against the rest of the country to get the nurses needed to staff beds and take care of patients in hospitals.
So we've seen an export of our nurses to Texas, where they were paying $175 an hour plus a sign-on bonus for traveling nurses. We've seen nurses leave and go everywhere, the West Coast, the East Coast, everywhere but Oklahoma.
Staffing agencies have come in and made very, very lucrative offers to our healthcare professionals to say, quit your job and come be a traveler, and we will redeploy you to other areas of the country for really, really high dollars.
Oklahoma hospitals are competing for staff by offering increased incentives.
We've got hospitals all over the state offering sign-on bonuses, not just for nurses, but other key healthcare positions. And let me just add, in COVID, it's not just nurses, it's respiratory therapists. It's a whole laundry list of healthcare professionals that are in shortage.
Long-term care facilities are competing for healthcare workers as well.
We're trying to remain, extremely competitive with our wages. We're trying to, provide exceptional benefits. And then we're also trying to have a workplace culture that is really wants them to, they want to come to work for us.
Todd Beasley is the Human Resources Director for long-term care company Diakonos Group. The company has 20 long-term health care facilities across the state, employing about 1,200 staffers. Beasley notes that those who are accepting jobs with his company now seem to be more prepared for what is at stake.
I would just say the people that were, coming to work for us now, I would say are higher quality. Because they've got no misunderstanding of what they're getting into.
Retaining long-term healthcare workers is important for residents at those facilities.
There's a direct correlation between longevity of an employee, a caregiver, and the type of quality of care that the resident receives.
What's unique in long-term care is it's extremely relational. Our seniors whom we honor and respect, and they deserve the utmost and excellent care, the relationship of having that same person caring for them day in and day out, that's an important part of their daily rhythm.
Oklahoma's healthcare worker shortage did not begin during the pandemic. It was predicted before anyone had heard of COVID-19.
for the last decade, hospitals and other health providers across Oklahoma have been drawing attention to the fact that we were already in a nursing shortage.
Oklahoma is rated number 46 in the nation for the numbers of registered nurses to 100,000 population. We register about 700 nurses to 100,000 citizens, and the national average is 1,100 to 100,000. So we're well beneath that, even the national average.
Using agency healthcare workers isn't cheap. According to a recent report by Kaiser Health News, a traveling nurse makes 200 to 300% more than a staff nurse makes.